Good afternoon, viewers. Welcome to this Facebook Live session. I'm Dr. Isha Fatherpekar, Resident Medical Officer from SL Raheja Hospital. With us, we have Dr. Kaustubh Mahajan. Dr. Kaustubh Mahajan is a neurologist and has an experience of 11 years in this field. He has completed his MBBS as well as post graduation from St. GS Medical College in Mumbai in 2005 and pursued and completed his training in DNB neurology from Hinduja Hospital in 2013. He is also a member of the prestigious American Academy of Neurology. Good afternoon, sir.
Hi.
Today's topic is dementia. So what is dementia and why does it happen?
Okay. So dementia is a growing kind of an epidemic as many people are aging more and the death rate has gone high up to from the average 60 years to now kind of 80, 85 years. So we see more dementia patients nowadays. Dementia is basically a neurological condition where there is degeneration of the brain slowly, causing decrease in the brain function, mainly in few domains like cognitive domains like memory, behavior, perceiving, and psychological issues.
Hmm.
Also, executive functioning is lost. So these domains slowly degenerate.
Hmm.
So that is dementia. And the most common cause of dementia is Alzheimer's. And there are
Okay.
many other causes as well.
Okay.
The second question I think you asked was why does it happen?
Yeah.
So as you see, as the it's basically a neurodegenerative process.
Hmm.
Like your hair becomes white
Hmm.
as you age,
Hmm.
certain cells in the brain shrink, and that
Hmm.
causes the dementia. It
Okay.
depends on what part of the brain will shrink, will cause that type of dementia. Like
Okay.
you have the temporal lobe, hippocampus, where your
Hmm.
recent memory is stored. If that
Hmm.
shrinks, then you get Alzheimer's. Then you
Okay.
have the frontal lobes, which are we call as kind of the hard disk of the brain, or where the mainly behavioral and other symptoms are there.
Hmm.
That starts shrinking, then you get something called as frontotemporal dementias.
Okay.
So this is how. So mainly it is age, but there are many other risk factors that will come to
Yeah.
it.
Yeah. So then what are the risk factors of dementia?
Uh, so the most important risk factor is age. As
Hmm.
you age, brain will shrink, and slowly, the degeneration will start. Now, second most important risk factor is if you have severe brain insults over the period of time, like trauma, infection, strokes, then your brain reserve has gone down, and that will lead to dementia in later life. Or maybe it was supposed to happen in 80s, now it will happen at 65, 70s. So the main risk factors, if you are not sleeping well, one. Second is sleep is very important to kind of clear the toxin process. There's something called as the glymphatic system, which does the job of clearing the unwanted toxins in the brain over the deep sleep.
Hmm.
And if that doesn't happen, then the toxins accumulate, which causes a destruction process by the inflammatory mechanisms in the brain, which causes further destruction and shrinking faster.
Hmm.
And that's one of the primary reasons why, if you don't have good enough deep sleep, then you will get a possibility of dementia earlier. So that is
Okay.
one important risk factors. Then coming to it, there are genetic risk factors, there are environmental risk factors, there are what you do basically. If you are not exercising much,
Hmm.
then obviously your circulation to the brain is going to be a little less, which will
Hmm.
slowly cause the brain to shrink faster. Not only that, but it will also cause um, the brain damage more because the toxin clearance won't be more, and that's how the damage process will increase.
Yeah. So since you mentioned genetic history, if I have a family history of dementia, uh, what is the risk factors? Am I sure to get dementia when I'm older?
This is a commonly asked question. Nowadays, dementia is so common. that many families you will see that there is some patient of dementia. The first thing, very important, is that if you have a strong family history of dementia, uh, the fact that you will get dementia is not 100%. You still have some control with you so that you can prevent or postpone the chances of your dementia. Now, basically, what we say is there's always, for in fact, for any genetic condition, a genetic tendency because of an abnormal gene is basically like holding the gun. But the environmental triggers, which also, if you don't follow, then that will behave like pulling the trigger and causing you the disease. So, this environmental triggers into the negative downhill course of dementia, that is it. So, what choices you should be making so that you prevent the environmental triggers causing you dementia later, that has to be selected and done. The important thing over here is that you will get dementia at the age of 75, 80, but the process has started almost 30, 40 years prior. That means the pathological process which has started the dementia has already started in your brain at the age of 35, 40, when there are no symptoms. And if you don't follow the environmental triggers and prevent them, the process will slowly further fasten up, and then you will get dementia at the age of 60, 70. So, what are these environmental triggers and what you can do to prevent them? So, there are many of them which you have a control over. And I first discussed it was good sleep, period. Sleep, the REM sleep, where your brain goes when you sleep in the later half of your sleep, is the sleep part where the lymphatic system will take care of clearing the toxins which have accumulated over the day. So, like you have your mobile phone where there's lot of kachra coming from all the various WhatsApp groups, and then it keeps accumulating. So the brain has this process where it will clear the toxins. What is unwanted will be cleared. If you don't clear, it will accumulate and then cause some damage because of the inflammatory destruction later. So, so uninterrupted good sleep is important. So you have to respect a good timing for your sleep. So there's something called a sleep hygiene, which has to be followed, which basically means that you have to have a time when you go to sleep, and that time should be respected every day. You decide what time. It will be 11 o'clock, 10 o'clock, whatever. Decide that time. But then 1 hour prior that time which you have decided, say 11 o'clock, then after 10 p.m. you should not be having any screen time. The screen, basically the mobile screen or a TV screen, tells your brain that there is brightness, and that's why it feels that it may be day and it keeps it activated. And so, whenever the natural sleep is going to come, which basically what happens when there's dark, brain secretes melatonin, which causes you to. So, that melatonin won't be secreted, and that is what causes you not to sleep because of the screen light brightness. So that is one part of this sleep hygiene. Second is there should be a fixed place where you sleep. Third is you should have no caffeine tea intake at least 5 hours prior your sleeping time. Next is you should be having some kind of physical activity so that your body gets tired so that you will sleep. So evening, if there's some kind of physical activity like a brisk walk for 30 minutes or some exercise will definitely help. So that's the sleep hygiene. Then second thing is, and very important thing is exercise. Now there's so much research going on dementias that because everybody and everyone nearby is getting that, and everybody's trying to see if what we can do to prevent. There's almost 40 years of strong research which has finally told us that there is no medicine which will come to prevent or cure the dementia.
Hmm.
There are medicines which will make you symptomatically better, but no medicine is as of now available which will cure or reverse the dementia, or for that matter, even slow down the process.
Hmm.
This is a very important step. And knowing the pathology, the way dementia happens, you will also know that in future also it is going to be difficult to reverse it.
Yeah.
So, so that's why these steps, which are time bound, proven to be safe and effective, which we ignore every time, is
Hmm.
something that's going to actually prevent and reverse uh, the process of dementia.
Hmm.
Exercise being one of the most important things. So there's one simple rule in dementia or in neurology or for brains. It is that the more you move, the better it is for your brain.
Hmm.
So it's basically movement causes increased circulation to the brain, and increased circulation causes increased clearance of the toxins and increased and better synapses, which
Hmm.
causes increase in brain reserve. So whenever we discuss dementia as well, there is
Hmm.
this two main concept.
Hmm.
Either you have to increase the brain reserve or
Hmm.
you have to prevent the brain damage or brain destruction.
Hmm.
Exercises is one way where you do both things. You improve the brain reserve by
Hmm.
improving synaptic connections.
Hmm.
Second is, you know what is synaptic connection? No? It is
Hmm.
basically chemical connections, how the brain communicates. So if you learn something new, a new synapse has been created.
Hmm.
And then that synapse, whether it has to be preserved or discarded, the brain will decide in sleep. So if it's a strong synapse, brain thinks it has to be preserved, it will continue.
Hmm.
That's how synapses are made by good brain circulation. And if unwanted synapses have to be cleared, then a good circulation is needed.
Hmm.
So anything which, so I tell my patients, anything which you like in any way to move, you you will be benefited by it. It's not only exercise or some yoga exercise. It's basically whatever you like, whether it's dancing, whether
Hmm.
it's walking, whether it's cardio, aerobic activity, swimming,
Hmm.
whatever. So it may be like it's raining outside, you can't go, you're living on the fourth floor, there is no lift. It may be as simple as walking on the same
Yeah.
time for maybe 20 minutes or doing static cycling. All these things can also help.
Hmm.
Okay.
Okay.
So these are the kind of
Yeah.
risk factors which will help you. So there's also, as I said, how to increase the brain reserve, which
Hmm.
will improve the chances of not getting dementia. Uh, so as I said, if you have increased social stimulation,
Hmm.
you have increased cognitive stimulation. All these will stimulate your brain so
Hmm.
that it remains active and new synapses are created.
Hmm.
So in social stimulation, surprisingly, has also those who are lonely, if they go, they will tend to kind of have dementia earlier.
Hmm.
Those who are socially active, those who have grandchildren, those who are in the community doing some help socially, these patients will be always staying away from dementia. So
Hmm.
that is nothing. So going to some book clubs, sharing your knowledge, teaching
Hmm.
grandchildren, teaching small children, or learning a new language, or learning a musical instrument, going to classes even at that age, all this will help. So again, this
Hmm.
very important point over here is you should not start when the symptoms of dementia have started.
Hmm.
You should start this at the age of 40, 45 when you don't have dementia, knowing that after that age things will be difficult. So,
Yeah.
or going to a gym where all like-minded people are there, going
Hmm.
to some club where you kind of socially are active and physically active. These things will help. I also tell people to do about cognitive stimulation. So
Hmm.
cognitive stimulation is basically there's a second important rule. Like first rule was movement helps brain. Second
Hmm.
important rule is challenges help brain. So you have any mental or physical challenges which you take, your brain will remain active and will stay away from dementia. So if everything is in a straightforward pattern, daily routine, where brain doesn't have to actually
Hmm.
think, um, not good for the brain in the long term. So you have to kind of have some challenges. So it may be very simple: learning a new language, learning a new musical instrument, or brushing with your left hand for one day, or
Hmm.
doing something different basically every day. That kind of
Hmm.
challenges the brain. So they say something like having a cold shower. So that is also a challenge. If you are used to having a warm shower and then one day you have cold shower, so
Hmm.
that also kind simple small thing can challenge your brain to help not
Hmm.
getting dementia.
So, any diet that you would recommend, any
Oh,
eating habits, or
okay.
smoking alcohol, how is it related to dementia, if at all it is?
Yeah. So the rule for diet is that whatever is good for the heart is good for the brain. Same, because it's basically about circulation to the brain. And diet, what has been proven to be benefited is Mediterranean diet. What is Mediterranean diet? It's basically ghas, foods, and fruits.
Salads.
It's
Salads.
vegetable salads, then your fruits, olive oil, all this. And these are the do's. And what are the don'ts? Don'ts may it is the red meat, no, then it is the fried stuff and refined sugar, carbohydrates, potato, bread, all these things are don'ts. So that diet has helped in dementias. Also, the risk factors which will reduce the circulation to your brain,
Hmm.
diabetes, blood pressure, cholesterol, dyslipidemia, all these risk factors also you have to take care. And so for that, whatever diet has to be followed, you have to follow. So
Okay.
one important thing, anything that damages your brain, those things we have to stay away from. So all these vascular risk factors, diabetes, blood pressure, cholesterol, slowly causes what we call a small vessel disease, where
Hmm.
circulation of the brain slowly shrinks, and that causes the brain damage over the period. So you
Hmm.
must have seen, I mean, there are these MRIs which we see of a 70-year-old
Hmm.
has hypertension and a 70-year-old who's healthy without hypertension. There's a significant white matter, there's gray matter, white matter. There's a significant white matter loss in these patients. So improving the brain reserve, take care of your vascular risk factors.
Okay.
That was about that.
Yeah.
Anything
Uh,
else?
so, any take-home message you would like to give the viewers? Like you have elaborated everything, but
Hmm. So take home message, main thing is that even if you have anybody, so one thing is if you have seen a patient with dementia, you should know that these patients are not doing anything on purpose. It's just that they forget things. You try to tell them, you try to rationalize with them. They may understand, but they are going to do the same mistake again and again. And once you've got the dementia, and you're in the moderate stage, things to be reversed are going to be difficult. So there is something called as caretaker burnout. Whoever has lived with a patient with dementia, that caretaker will eventually kind of burn out because of the frustration. So you have to know how you will kind of approach these patients. There's a simple training which we tell them. If you do that, then definitely your perception and outlook towards these patients with dementia changes, and what was initially frustrating will not be frustrating, and your life will be also simpler.
yes.
If you don't want to go into that state of dementia, don't wait for the age of 60, 65 to start before only. And those things which I told you, simple things like sleep, exercise, diet, social stimulation, cognitive stimulation, taking challenges, start with small steps. Now, all whatever I've said is very easy for me to tell, but
Yeah.
then those everyday choices which you make eventually matters. So
Yeah.
how to kind of train yourself to take the good choices, that's also important. There's one simple rule in that: take small steps. Take small steps. Like if you want to go, you have decided that you have to go for exercise every day, don't tell your brain that I am going to go for a half an hour run today. Tell your brain, I'm just going to go wear my shoes and put one step outside. So once you trick your brain that I'm going to do a very simple task, it's easy to do the same. And once you're out of your house with the shoes, you will have the half an hour run. But if
Yeah.
you are sleeping and you tell that I have to go for an half an hour, you will quickly go back into the bed. Take small steps and be consistent. That's how your choices will become more constructive.
Yeah.
Okay.
Okay, thank you, sir, so much. Yeah,
Yeah.
very
Thank
informative. Thank you. Thank
you. I hope you are done.
you. Yes.
Is there a There's no question in the chat box or anything, no? We can
So
leave.
there's no chat box.